So it's now my great pleasure to introduce our newest advocate and pain champion, best-selling author Tara Moss. Thank you so much for joining us from Canada, Tara. Since 1999, Tara has written 13 best-selling books. She's an outspoken advocate for human rights and the rights of women, children and people with disabilities. She brings her own lived experience of chronic pain to her advocacy. It is wonderful to have Tara with us live from Canada. Thank you so much for joining us, Tara, and we look forward to hearing what you have to say. Thank you.
Thank you for that beautiful introduction. And I just want to say congratulations on the National Action Plan. It's incredibly exciting. And I have to praise everyone who has been involved in making that happen. My absolute thanks and congratulations to you. So thank you, Painaustralia, for the opportunity to speak today. Perhaps if you're listening right now, you recognize me from my novels or perhaps from TV or perhaps not at all. But I speak today as a human being, as someone with chronic pain diagnosed with CRPS after an injury 5 years ago. The topic of pain is not theoretical to me. Over the past few years, I've had to adapt to life as a disabled mobility aid user and ambulatory wheelchair user. In fact, I'm sitting right now in my trusty wheelchair, Hera, named after the Greek goddess. Now, as complex regional pain syndrome, or CRPS, is not very well understood by many, I'll just briefly explain that it can be characterized roughly as a condition causing pain disproportionate to the original injury, most commonly impacting an injured limb, for me, the right hip and leg, as well as the central and peripheral nervous systems, and a host of other systems in the body, including the immune system. Now, according to the McGill Pain Scale, CRPS is the most painful condition, and sadly, it has been nicknamed the suicide disease. Not the sort of thing you want to hear about when you get a diagnosis. However you wish to rate or describe it or other chronic pain conditions we live with, I won't lie, it is challenging, and it has forced me to find new reserves of strength within myself. Like many, my pain levels, my body, and my abilities are not static. They change daily. My condition is also essentially invisible, and that's something I really want to talk about today. The fact that pain is invisible, but the fact that it's invisible does not mean it's not there. We have to really open up this discussion about pain, in part because of its invisibility. In fact, as I mentioned, about 90% of disabilities are invisible, and many of those involve regular pain management. In fact, many of our pain champions fall into that bracket as well. As I've said, I'm honored to be a pain champion, but in reality, pain kicks my butt. If I can help to champion discussions around chronic pain, though, that is an honor. Living with CRPS is a daily mountain I need to climb, and the pathways change all the time. Some days I might make it to the top of that mountain, but frequently I never make it out of base camp, or I may not even make it out of my bedclothes. That's the reality of living with chronic pain. It keeps me on my toes or not, as the case may be. So I speak to you today not as a health professional or as a politician, not as an expert or someone claiming any universal experience that I can share, but simply as one individual, someone with years of daily pain, juggling medical systems in 2 countries, with experience as a pain patient in both Australia and Canada, both countries I'm a citizen of. Because pain is invisible, it is too often dismissed. Pain patients know this from experience, and if there's anything I can do right now to be useful to them and to you, it is to convey most passionately that those living with pain are asking to be heard, and many of them, unfortunately, are frustrated. Too often, they don't feel heard in the medical system, and they don't feel that their pain is taken seriously. Recent studies suggest there are some good reasons why some people feel that way. A recent piece in the Australian Journal of Primary Health, for example, noted that GPs routinely underestimate the severity of patient pain. We know that pain matters as a lived experience, but both clinically and in terms of that lived experience as well. Untreated pain leads to poor health outcomes. often disastrously so. I'm sure you'll all agree that untreated pain is cruel, and we know it corresponds strongly with depression, anxiety, and other mental health issues. Substance abuse, because there may be no other relief available, sometimes permanent physical and neurological changes, disability, loss of work, social isolation, and yes, sadly, even suicide. This is why I want to thank with all my heart Painaustralia for focusing on this topic and for pushing ahead with this national action plan, because it matters. So thank you for listening to this, to pain patients, and for focusing on this topic. Now, I do want to speak briefly in the time I have left here on an issue that I'm aware is controversial to some in Australia, and that is medicinal cannabis. In my lived experience as a chronic pain patient, particularly as someone with neurological pain, I can tell you that medicinal cannabis is prescribed by neurologists here in Canada, and successfully so, and can aid in implementing multidisciplinary pain management programs. It's my firm belief that many people living with an array of health conditions are best served by a system that allows and facilitates access to a range of different pain management strategies and products, including this. It's best shown to be things like full spectrum rather than simply CBD, to be beneficial for some with neurological conditions. Now, because of that, neurologists like those that I see here in Canada routinely prescribe it, allowing patients like myself to simply see if it works for them or not, without jumping through the hoops of access issues or trialing inferior products that have little chance of success in easing their pain and associated health issues like anxiety, muscle spasms, and more. If doctors are worried about legal red tape or judgment, they will not prescribe. If patients are worried about judgment and legal ramifications, they will not ask. Where there is a lack of clarity and openness and a great deal of confusion as to what products are available and what can be tried, there is a lack of application that could help patients in Australia in real concrete ways and show physicians what may be possible. This is not in the best interest of doctors, patients, or best practice care. We must balance treatment options with potential harm. And my view, this is my personal view, is that Australia is behind other countries currently in recognizing the benefits of these options. And the harm of prohibition is being felt by Australian pain sufferers. I know this because I've felt it myself, and I've been told this by others with chronic pain. And what's more, like I said, they are being vocal about it. A full toolkit of care and management options must be made available to Australian chronic pain patients. One size truly does not fit all. Those involved with chronic pain care know how complex it can be. Acute pain and chronic pain should not be confused. They are different beasts, and different approaches are necessary to manage them. Again, pain is invisible. That does not mean it isn't there or that there are no consequences for leaving it untreated. So if there's one thing I wish for you to come away with today from what I have said to you, it would simply be this: listen to patients about their pain. Listen to chronic pain patients about their experiences and their needs. Greater understanding is the road to better care. A system that does not listen or understand has no chance of achieving best practice. And I know that's what we're all here for. That's what we want, and that's what we're striving for. Thank you so much for the honor of speaking today, and thank you for listening.